backs. I mean, you name it, right? Things happen.
Especially at our age.
Yes, things happen all the time. So each week, especially with sports, we like to take a little visit from our friends at Rothman Institute. I love Rothman Orthopaedics. Rothman Orthopaedics, they saved my Achilles. I'm forever grateful to Rothman. And joining us is Dr. John Salvo, who is terrific, an orthopedic surgeon for the Eagles medical staff. Man, he's been an associate professor of orthopedic surgery at Thomas Jefferson University. He's consults with the Phillies, assistant team physician for the Flyers. I mean, he's fantastic. Dr. Salvo, good morning.
Hey, how you guys doing?
Hey, before we get into it, I got to ask you a question. Was your dad a doctor?
Yes.
In South Philly?
At Methodist, yeah. Yeah, he was the orthopedic surgeon there for about 30 years. Why? What did he do to you?
Doc. Dr. Salvo was our family doctor.
Yeah.
Oh, my God. He was the greatest.
Yeah, he still is. He's 90. He's still plugging along. Obviously he's not practicing anymore, but yeah, he was down there forever.
Oh, are you kidding me? I can hear my grandma saying, "Oh, Anthony, I don't feel good. I got to go see Dr. Salvo." And whatever your father said was gold. It was just everybody, the whole family trusted Dr. Salvo. Whatever he said was it. They could ask him anything about life, not just medical.
He's a good man. But thank you.
Yeah, God bless you. I
just had down there forever.
I saw your name. I'm like, I wonder if this is fantastic. All right, so
I can get him on if you want.
So I want to ask you about the knee, and I just want to qualify it and say that Dr. Salvo is not Joel Embiid's doctor, knows nothing about the situation, and we're going to talk in generalities. Let's talk about the knee itself. And the whole week long was about Joel Embiid. And, when he's ready, we keep hearing ramp it up. We keep hearing about the brace. He doesn't like it. The whole thing. Explain what the knee, and when you have that kind of condition, how you deal with it.
Right. So with the knee, the main structures you're dealing with the knee are the ligaments, like the ACL, the PCL, to keep it stable, the meniscus, which are the shock absorbers of the knee, and then the articular cartilage, which is the covering of the bone. So, just from what I know from public domain, Joel's dealing with the meniscus on the outside. It's the lateral meniscus. I believe he's had 2 surgeries on that one and one on his other knee. But the issue with the meniscus, it's a shock absorber and it provides some stability as well. So when you get a tear in it, then they can have pain, their knee can buckle and give out, they have swelling, and then you have a massive elite athlete in Joel who puts a lot of pressure over everything anyway, just because of his size and the way he plays. So he had a tear, he had surgery, it was successful, he was able to get back. And then he had another injury to the same knee at the, when he was really cooking last year before he hurt it. And I think that was at the end of January, and I think he had his surgery like a week later. And then it was going through rehab to try to get the knee back right to where it needs to be. Now, 2 ways the meniscus is addressed, and it depends on what the tear pattern is and the blood supply. If it's torn all the way in the back where there's good blood supply, typically you're putting sutures in that to let it heal so you can have your entire meniscus. And that recovery is usually 4 months for an athlete to get back to sports. The more common ones are the ones we need to go trim it because it's on the inner part of the meniscus where there's not really blood supply, so you can't get it to heal. And if that's what's happened now twice, you lose a little bit more meniscus each time, and then your concerns are in generality, then you want to know, his ligaments are fine, but you want to make sure that the articular cartilage is not starting to have some breakdown as well. And then once you get the swelling down, the motion, the strength, then you got to start ramping them up activity-wise. Now, I know there's a lot of controversy over, end of the season, got through the playoffs. went to the Olympics, an athlete's going to do what they got to do. You can only have
Right.
so many chances at the Olympics. But from orthopedic standpoint, you want the swelling down, you want full motion, you want to be able to run and cut and pound on it. The brace is probably giving him some support, and that can help kind of unload that compartment sometimes on the outside part of the knee, and it's all protective measures. And to let him do what he is so good at. But until they meet that criteria, when the swelling is all down, when they have the full motion, they can pound, they can jump, they can run, they can jump with somebody hanging on them, the things he needs to do in practice and games. When he's ready, he's ready.
So is there a greater risk for re-injury?
So again, in generalities, once you have a tear in your meniscus and you have, say you have an arthroscopy and you have to trim the cartilage, that is already vulnerable tissue, but well over 90% of them recover to full activities don't have another problem. But when you have another problem, and if it's in the same area, you're starting to scrape a scab again, and that's why you have to go just clinically, not only just with repeat MRIs, make sure everything looks okay, but clinically, how is he doing? How is he responding to treatments? Sometimes when people are having recurrent symptoms, then if anti-inflammatory medicines aren't doing it, bracing isn't doing it, then there's all kinds of different injectable treatments, not cortisone, but more things like platelet-rich plasma or stem cell therapy, things that were not available in the States like in the 90s.
Yeah.
And that are available now, and those things do help. But get the details of his case, you'll never see the details about what they're doing. I mean, the Sixers medical staff, I know them; they're fantastic.
Yeah.
They're all about making sure the athlete is healthy and back when he's healthy.
If the worry is a lack of cartilage, is there? I'm sure the advances. Do they do artificial cartilage for the shock absorber?
Yeah, but that's a really more of a salvage procedure, and you're not typically going to do that in a high level athlete that's still in their career. That may be something down the road when he's done playing, that if he's having issues, they may consider that. And there's a whole bunch of different factors that are just kind of tough to go through in a few minutes. But that not typically during their playing career would they consider that.
Again, speaking in generalities, and we know this term a lot, load management is for something like this injury, or when we talk about the knee, that sort of thing. Is load management, absolutely necessary, or is it just playing the you're basically limiting the chances of him getting hurt by him not playing, or anybody?
Right. So I mean, we do that. We do that in our college athletes, sometimes high school athletes, when they're coming back and pushing up on the start of a football season or lacrosse season. They might be recovered, but not in football shape, right? So at the beginning of the season, then you do a little bit of load management. You limit their stuff in practices. If they're safe in a game, you do it. This is the same kind of thing. You're using your clinical judgment on how the athlete is responding to the treatments, what he's telling you his knee feels and what it looks like. And if you have to, slow him down or shut him down or whatever you need to do to minimize that knee getting irritated, you want to play the end game with this and make sure an athlete like that is ready to go when it's time.
Yeah. Is there, especially I guess when it comes to back-to-backs, just because all the pounding and then you come right back the next day,
right.
Sense.
And then the back-to-backs also with travel, some are home and away. And,
how does that affect how does air travel affect our bodies like that? I've always been curious about that.
That's not an orthopedic question, but it is anybody who's traveled. I mean, these guys are traveling different than we do when we're, going through Philly Airport on Spirit Airlines. It's a little different, but they're set up
when
pretty
you're going
well.
to Rome.
Exactly. So, I mean, I know, with the Eagles, all the medical team, everybody has everything kind of tuned in. They have the same routine. On an away game, they want to get there to the hotel by 4 o'clock
Yeah.
and then start their clock, right? Because everything's pretty regimented. And I'm sure the Sixers do the same thing. The Flyers do the same thing. To minimize the effect of travel on the athletes.
Yeah. It's just so, I guess I just meant more from, is there a pressure or is there, something that happens to
I mean,
our bodies?
it can irritate it, but it's nothing to worry about that you wouldn't
Yeah.
tell them, you got to
Yeah.
do a John Madden and take a bus.
Yeah. Doc, what a pleasure, man. Hey, you're
Thank you.
terrific.
Thank you, guys. I'm
Now,
happy I
are
could
you,
be here, and thank you for having me.
Are you a 4 for 5? I'm sure you grew up loving sports, loving all the teams. You're a true Philadelphian.
Yep, through and through.
I love it, man. Thank you, Doc. Have a great weekend, buddy.
All right.
Dr. John Salvo, Rothman Orthopaedics.